So welcome to India Top Doctor. As you know, today we're speaking about the neurological situation post-COVID era. So my first question is, what are the psychological problems associated with COVID-19?
No, psychological problems associated with COVID-19, we see definitely the depression, number one. And number two, the most important point, I always want to call it as a post-COVID complications, A to E, if you remember, not only psychological, but neurological also. A is, of course, you get a mild altered sensorium in their behavior. B, basically, sometimes you can get cranial palsies, especially affecting the third, fifth, and seventh. And C stands for one can get stroke. One can also get heart problems. D stands for they can come and complain of dizziness. E, they can have an epilepsy. And F, fatigue, and as well as the pain in all over the muscles. This is during the attack, but after the attack, we find some people who have mania disorder, MDD, they get their mania and as well as depressive disorders getting exaggerated. Second, psychologically in dementia patients, there is a transient increase in the memory disturbances of these patients. And they get an increased difficulty in that plane also. So you get the memory is affected, their anxiety is also there. So I always call it post-COVID, they become mad. M is mania, A is of course anxiety, D is depression. And some of them, they get extremely fatigued, something presenting like a fibromyalgic syndrome. Over a period of time, they slowly get over it. But one should remember that this can be a factor affecting them totally. So you should be very, very careful. And apart from that, some people do develop pain in their legs, pain in these fingers, which is not anatomically oriented. They do have pains all over the body. So answering to your point, I will say simply, patients become mad. That is a clue. M stands for mania getting exaggerated, anxiety getting exaggerated, and the D, depression, you also see. And basically, we divide the psychological disturbances, one that concerns with the thought or with the mood. Here, the mood is more affected than the thought.
Okay, sir, very well said. So you have mentioned quite a few problems which are associated with it. Can you tell us how can one care for mental health during or post-COVID era?
The mental health, I think, basically, I would say you should have a very calm, cool, collective approach and give them the positive feedback. I always call it the attitude should be positive. The aptitude should be very, very both physical and mental. So these two factors, when they are combined, and give them the hope and treat them with absolute care of love. Once you treat them with absolute care of love and then take care of it medically and psychologically, you give them the boost and then they should do well. In other words, take care of them. To put it in one shell, I always say medicine here, medicine plus love with them, they get the Medicare very well. When they don't get the love in the house and in the office because they get corona, they get completely defeated. And I always call that as the doctors, it is a medicine. So you should SIN, not as in. So I always say that they should give A, attitude to make them positive. B, the aptitude gives them both physical and mental calmness. C, they should be taught as a perfect character and the behavior. All of them should be done with love. Then they should not be afraid of this problem. See, the basic fear, the fear is operating in them. That makes them more troublesome, and that fear itself makes them really go bad. If you show them the love And if you take care of them, you will find that the fear disappears like a morning mist under a rising sun. I think that is going to help them a lot rather than anything else. I think you have to have your drugs also, because when you look at this, they should understand their problem. For any problem, I give this. You get a Venn diagram. Coping up mechanisms, communication skills, and then the compliance skills. The coping up is making the patient to accept that they have corona or they have had corona. And B, the communication should be coming through you like this. And second, the doctor's communication, and then the literature. When all of them combine, communication and as well as coping methods are good, actually the complaints of the patient will be good. And what you get in that is cure or control of the whole problem. I always feel that most of the psychological problems, you should deal it with absolute unselfish love.
Absolutely, sir. All right. So can you tell us about the resources which are required in neurology post-COVID era?
The most important thing that I should always, I always call it, what are the challenges first faced in India before you go for the resources due to post-corona period. We have a limited resources for the health. Second, choosing the right diagnostic method. Third, fear of contamination of the scanners in which we go and work. Performing surgery or autopsy for the patients. Shortages of personal protective equipments. Long working hours for the doctors and staff nurses and the health workers. Violence against healthcare workers. Increased risk of infection due to the people involved in the treatment of corona. Spread of infection to the colleagues, family members, and then the friends, and then the patients. Social, economic, and family impact. I always say that this is the most important point. Unless you activate on this particular problem, you are not going to get it. So using our resources, you have identified the difficulties. And what is the next? I personally feel that you should have a staff training. The staff training is ensuring that the clinical staff know the right ways to put on and take the personal equipment. Recognize the symptoms very early in the patient and teach them. This is with regard to the staff training. Fever, cough, shortness of breath. Implement procedures quickly to triage and then separate the patients. Emphasize the hand hygiene and cough etiquette for everyone. And ask the staff to stay at home if they are sick, and workers if symptoms develop. Why I am giving this is actually a curative part. The resources is, I always call it, one should have 3 M's in life. The first M is the motivation. Everybody is motivated towards really doing something for this condition. When there is when there is motivation, you should have money power. And the money power should be mixed with manpower. So when motivation, money power, and manpower combine, you get an absolute success. So in the resources, you have to have these 3. But one should not have the 3M attitude. That is, I call it as a megalomaniac man's attitude, that you know everything to manage it with whatever you have. I think that attitude will spoil. So the first resource is your mind, because the mind can act on the brain, but the brain cannot act on the mind. And the mind requires the full, really the necessity for resources and every part of it. And next, when it comes to the doctors and preparing the clinic, this is the second type of resources, and we can go by that method. First, we have talked about the staff training, and then the second is preparing the clinic. How do you prepare the clinic? Know which one of your patients are higher risk and adverse outcomes first. Consider and plan for providing more telemedicine. because I want to concentrate on telemedicine today so that people can definitely get a much better. That is one of the resources in which you should have it. Stay connected with your health department, set up precautions, and access restock supplies that are on a regular schedule. Having understood number people training, preparing the clinic, the third step is how much of equipments and as well as the instruments that we have. All the equipments used in the triage area are cleaned after patient examination. This should be routinely taught to the person trained there. And a separate sterilizer must be kept in the triage area to sterilize all instruments. And this is requirement. First, we talked about the resource. This is a requirement which is necessary for each and every clinic, those who are managing the corona. Then the second point is ultraviolet sterilization. The instruments must be mandatory. The preliminary research very clearly suggested that ultraviolet may kill the COVID-19 virus. Therefore, UV lights from the hospital must be immediately installed in the triage area where you go and then see the patient. This is a requirement. Even though we have passed the post-COVID era, there's nothing prevents us from getting odd cases coming into the triage area of the hospital, but it should be equipped with the ultraviolet sterilization. Every day, high-risk triage must be sterilized. Ultraviolet rays are switched on daily at night. That is the most important thing that should not be forgotten. So you have instruments, you have sterilization and other preventive precautions which are to be done in each and every hospital and nursing homes. Like all windows must be open. No air conditioning system is in use order to prevent the theoretical dissemination through the system. All doors must be kept open to reduce patient staff touching. All window curtains are removed. And inpatients allocated only for one first floor. In other words, what you really need the resources for the prevention of guidelines for medical and paramedical personnel and different locations. I really give them the sequence like reception, outpatient examination, ward, administrative, laboratory, pharmacy, and housekeeping, in which you look at it. Availability of hand sanitizer should be available everywhere. Wearing of mask must be everywhere. Availability of the gloves and the protective gloves. So we should see to it that these equipments are in plenty and they should not come with short of time and short of things also. Communication with patients are mandatory. We have just studied already. All those things will help us for the coping mechanism for the patient. The communication, if it is properly done, it will be an excellent one. And I think the communication should be done at the healthcare provider at the front desk. And the front desk people must be protected well, because where they are the people who are receiving the cases. 1 minute extra time is needed because they also should be protected. Protect the working people in the reception areas. Use a face mask while working on reception. Educate them with the importance of the way of infection. All patients should be asked about the following: about the international travel within the last 14 days, signs and symptoms of respiratory infection. In the last 14 days, he had contacts with someone with or without investigation of COVID-19. This must be taught at the level of the healthcare providers so that they ask the questions very routinely rather than operating through the mind. Because in life, memory, pity, and beauty are short-lived, but tinged with emotion persist throughout your life. So you should be taking care of this. The role of the healthcare provider in the outpatient department, you must take it. The virtual patient examination. This is I call it as a most important one for doctors. And this is a very good resource that they should have, and so that they are using it in the patients. In our current situation, the healthcare is changing with the incorporation of new technologies to assist our work. The virtual physical examination does pose some limitations compared with the traditional in-person. While examining the patient, instead of looking Instead of looking directly into the lens, it likes you to take eye contact, it can spread. So you can use later equipments. That requires a very important one. So consultation, everything you can do, and the future of, I call it, for dealing with such cases where there is highly infected, the most important point is telemedicine. Now, all the people telemedicine, if you look at it, I want to draw this advantages of the telemedicine for 2 minutes, because people should understand the advantages of telemedicine. And fortunately, the president, Professor K. Ganapathy from neurosurgeon, is the president of the telemedicine from Apollo. He has also spoken so much about it, but I would like to say that the advantages of telemedicine here is high quality of life and higher quality of care. This must be clearly mentioned. Higher, it should be in the office itself. The higher quality of care is being done by the physician, and the higher quality of life is given by the cost bearer. Now, the two things are disease management, risk, reduced period of hospitalization, and the transparency of the cost and services. The quality assurances must also be maintained. The high quality of care with regard to physicians are security of the quality of life, therapy guidance and control, and budget relief and optimized time management, and direct guidance and training of patients. The optimization of therapy using guidelines, all of them will lead to higher cost efficiency. That is where we should be. We should not be spending our money too much. And this will help us by higher efficiency. Means what I mean is the telemedicine will get lower medication costs, and above all, improved compliance of the patient, changing lifestyle and acceptance of the disease. So you are able to combine the coping mechanisms, the communication mechanisms well by this, so that your research is really very good. And most important thing that I want to say is telemedicine, both clinical and non-clinical. I always call it as telehealth. The telemedicine is purely clinical. E-health is clinical and as well as non-clinical, and telecare is non-clinical totally. All the three merges in the assistive technology by aids, alarm, and ambience. And when you look at the telemedicine clinical, it consists of 3 parts. And the telemedicine is synchronous, or it can be a remote one, or it can be an asynchronous one. And the mobile medicine is also telemedicine is very good, and it is also clinical. So I'm giving this as a flow chart, and you find that the institution focused or home focused. All these things are all the requirements for a place, so that if the telemedicine comes into play, effective utilization of people, effective utilization of your instruments, and as well as the cost effectiveness, all of them can become, and then the increased medical skill, when it is handled, you get an increased telemedicine requirements. Now, when you look at it, what are the latest equipments that have come into our fold, which are the resources which requires resources, and we have resources, we have to use it. One is the Wi-Fi smart scale, where you can communicate very well, and the Bluetooth stethoscope. The Bluetooth stethoscope, you don't have to virtually go near the patient and then start auscultating. This is going to be a Bluetooth stethoscope. Otoscope is also like this, where you can examine the ear at a distance. Now, the blood glucose meter to easily study the glucose levels. Even the blood pressure monitor has come as an instrument which will make us to do it. So these are all the requirements. In a patient when he steps in, I call it as a requirements in a clinical institution or in a hospital. And the digital thermometer is a much better one, rather than really putting it in the mouth or in the rectum in the patients to find out the body temperature. So that these are all a mandatory requirement from the doctor's angle, or as well as from the patient's angle. It's easier. I think what we can do with this, but if you have a standard of excellence, if you have enough money, then you can go for robotics. And the robotics, you can do surgery, you can do robotic surgery and live monitoring of via the cell phones. So you can just see these are all the requirements for a post-COVID area patients. It's going to be, it's not going to be, I always call it, you cannot have a dream in the hot sun. Whereas you can definitely make it a reality, even if it is a hot sun, only by very, very important working through this way. What are the necessities needed? How will you really do it? And I always call it as a smart OPD. The future, how is it going to be in after the corona? Number one, it's going to be a smart OPD. Contains 2 air-conditioned chambers, one for the doctor and one for the patient. 2, a glass barrier is in between and the two-way communication system is easier. Doctors check the patient using a smart stethoscope developed the startup, which allows listening, recording, transmitting the chest sounds over wireless networks without touching the patient. Third, smart OPD booths equipped with a disinfection system, which is going to be an excellent one in the future OPD. Now, the future biosticker, what do you mean by that? The FDA cleared recently from US biosticker, the medical discovery, worn in the upper left chest for effortless remote data capturing and simplistic stick it on and forget it patient experience. Single use of medical device for about 30 days, continuous vital signs monitoring, respiratory rate, heart rate at rest, and skin temperature. Body positions, activities at the level and the skin temperature. The body position and the activities level and sleep status. High resolution gait analysis of the patient and a fall detection in the patient and the symptomatic events. You can just get everything with this bio sticker, just sticking to the left side. These are all what I call it as the requirements in future hospitals and nursing homes and clinics, where the developing country will become a developed country, and the developed country will have all these things in the, not in the very far future, but in the distant near future. I think it is going to be a very well analysis of retirements, resources, and finally, of course, the New Year thing, the future, how is it going to be? If you do that, what is the effect? A, you shield yourself in isolation rooms. B, areas of the patient transit, the triage, the laboratory, the OPD area, the staff and all the doctors can do their service absolutely at ease and with confidence and care is going to be an absolute use. So, in other words, personal and family care as healthcare workers, you have to protect yourself and you are protecting your family. I would like to just say what is the focus of the psychological well-being, which you asked in the first question. I was just giving a very brief answer. I think the psychological well-being is one, tackling the stress, tackling the anxiety, tackling the depression, hopelessness and helplessness and loneliness, sleepless and insomnia, fatigue and exhaustion, hostility and somatic symptoms. These are the psychological well-being for patients, especially post-COVID era. You can see, I always call it the 7 things, the 7 very, very psychological well-being. You should do it. And what is the things to do at the personal level to maintain the emotional balance? This will be very useful for patients who are going to be affected with the emotional and maniac disorder. Try and accept what is expected as, how you fit into this group, take precautionary measures before and after the work, get full information from the authentic source, keep in touch with your near and dear on regular basis, practice mindfulness. This is a very important point on the yoga style. deep breathing exercises, try and rehearse your spiritual rituals, try to keep environmental as light as possible. Constantly communicate with your colleagues and doctors and friends. Keep focusing on the positive and realizing thoughts, and don't get lost in negative or imaginary thoughts. This is my advice. I can give it to patients who are affected with the psychological not well-being, but gives them a very big, cool, calm, collective attitude, gives them and the absolute Medicare by the doctors.
Okay, so my next question is, so we talked enough about the situations which are associated with it, but we haven't talked about the treatments yet. So what is your opinion? Like, can you tell us about how the symptoms of neurological problems post-COVID era are treated?
Now, post-COVID era, when patients come, I want them to be investigated with C-reactive protein and D-dimer once in 2 to 3 months. If it is elevated, it is likely to produce either a stroke, cerebral, or they can have a heart attack. So one should be very, very careful with regard to post-COVID, and they should see that. And second, incidence of epilepsy, statistically it has not come. What I call it, there is no evidence-based medicine, but expert-based medicine and experience-based medicine, you find that there is an increase in the seizures in some people. The cognitive decline is high in some people. Even the depressive people, extremely more affected. And the people who had an original peripheral neuropathy, which produces pain, weakness, wasting, and numbness, those people also start getting increased, and they find that they're not able to walk. And these patients should have very good physiotherapy, and they should be immediately, the treatment, the drugs are one and the same, both when they're in good health without corona, when they get these diseases, whatever drugs that you use, you have to use this. But only thing is, you have to be careful in recognizing it. The British people, when their analysis, up to 2 years, you have to watch for the post-COVID complications. In some people, they can develop neuropathy. In some people, they can get epilepsy. In some people, they can get stroke. In some people, they can get heart attacks. In some people, they can get extreme fatigue and fibromyalgic syndrome. And above all, the taste and smell are not coming in them. So treatment-wise, you must see a neurologist, cardiologist, or a general physician and use the appropriate drugs. But the necessity is you should investigate for them. For some people, get the platelets reduced during the infection and especially corona. They can have a bleeding tendency. So you should verify how your platelets are. So simple guideline I would rather give for a post-COVID patient, do a hemogram, do definitely the platelet count, estimate the serum B12 and serum D3. And in addition, always do CRP and as well as D-dimer. If the values go up, immediately you must be in touch with both infectious specialists and your family physicians so that they are started on the drugs immediately.
Okay, all right. So we've had enough information today, and thank you so much, sir, for that. Do you have any message for our audience?
I think I will, 1 minute. We have had so many discussion we have done, but for people, 3 ways the people, when they get out of the infection, the initial infection is over with insignificant symptoms. The second is the disease, when they progress, they should have the oxygen PO2 machine with their house, so that when that level falls below 90, then watch out, they should be able to go to a doctor and then do it. And above all, watch out for the symptoms, and the condition is only recognition. And if the recognition is good, immediately you can start the treatment for them. And I would like to just say on the psychological factors, which you have already done. But my last words with regard to the position is adapt and transform. What do you mean by that? Innovate your clinical practice with whatever I have suggested to you. 2, harness new technology so that it is very useful for your practice. Encourage teleconsultation. Train yourself and your staff for the new normal state which you're going to have in future. Use a protective gears even though the disease is absolutely coming down. Be careful in issuing the certificates. It can just floor you down. Update your medical knowledge. This is meant for doctors like us. And protect yourself and take care of your loved ones. I just want to finish it by this statement. Medicines cure the diseases, but only doctors can cure the patients. Thank you.
Absolutely well said, sir. Thank you so much, sir.
Thank you very much. Nice of you too.